Hello, good morning, good evening, everybody. I'm Dr. Asavari Manvikar. I would like to welcome you all to CAR Global Webinar Research Series. CAR, Council for Ayurveda Research, is an international non-profit organization based out of USA with its sister chapter in India by the name of Ayurvidya Anusandhan Abhiyan Foundation, AAAF. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. And no nonprofit can operate and succeed without volunteers. So we would love to have your participation as a volunteer. We will place you in a variety of projects based on your skills as well as your interest. Once again, our website is www.ayurvedaresearchusa.org. Now let me introduce our platinum sponsor, KomalHerbals.com. It's a company based in Pennsylvania. It is focused on the concepts of Ayurveda and the power of being healthy using herbals and natural products. Komal Herbals work hard to find premium ingredients for their herbal formulations. They also source herbs and spices that are sustainably and organically grown around the world. Now let me introduce our eminent speaker today. She is Dr.Deepali Bhise. She has done BAMS, Bachelor of Ayurvedic Medicine and Surgery from Kark College, Akurdi, Pune University. And she has done her Master's MD in Ayurveda in Stri Rog from Government of Ayurveda College, University of Kerala. She is Ayurvedic consulting gynecologist at Bhise Clinic in Nigri, more than 20 years. She is a speaker at international Ayurveda conferences. She is a specialist expert at Advita Women's Healthcare and Wellness Center, Pune. She has been working as Ayurvedic consulting gynecologist more than 20 years of the experience in treating various gynecological diseases, such as PCOD, menstrual abnormalities, heavy menstrual bleeding, genitourinary disorders, Ayurvedic preconceptional, antenatal, and postnatal care, and treatment, and also endocrinal disorders such as hypothyroidism, diabetes in women, obesity, alopecia, acne, and has special expertise in management of female infertility with Ayurvedic medicinal and Kerala special therapies. She has presented many papers at various organizations and conferences. She has presented a paper at Ayurveda for preconception care for women at the International Conference at London in UK in 2017. She has presented a paper on Ayurveda for women's health during menopause at International Conference in Greece in 2019, and practical aspect of Ayurvedic management of PCOD at the webinar conducted on national level in 2020. She has been awarded with Women's Excellence Award by Phoenix Hospital, Pune. Thank you so much for being here. Welcome, Dr. Deepali. I would love to hear your expertise.
Thank you, Dr. Asavari. Thank you so much. Thank you for giving me, first of all, this opportunity so that I can present my research work in front of all of you, all the members of CAR, and all those who are interested in the science of Ayurveda. Okay, so with the blessings of Lord Dhanvantari and my teachers, my gurus, I'll begin my humble effort to put forward my thesis, which I have conducted. This is my research work that I had conducted in my post graduation days back uh, at Government Ayurveda College, Trivandrum, Kerala. So before I begin my presentation, I would just like to place a disclaimer here that this particular study was conducted around 20 plus years ago. That is around 2000, 2001. So seeing the time span that has followed after that, I'm sure a lot of advances have taken place in the field of research, even in the field of research in Ayurveda. And so some of the methods may seem quite crude, basic, but they were a sincere effort in whatever resources were available in those times. Okay. And definitely the study was very, very fruitful for me and very helpful for me in my practice. Okay. So let's start.
Yeah, thank you.
Okay. My research work was comparative study of the efficacy of Kashmarya Kutaj Grita Uttar Basti and Pushyanuga Churnam in Asrugdar, that is dysfunctional uterine bleeding. Next slide, please. Yeah. Just before going into the details of research, I would just uh, rush in through a little bit of the literary view regarding the topic. As far as Asrugdaram or dysfunctional uterine bleeding or any abnormal uterine bleeding is concerned, the following characteristics or features are necessary for being diagnosed as a case of Asrugdaram. And they are: the patient should be having prolonged menstrual flow, that is more than Pancharatra Anubandhi, as Ayurveda says. So it should be more than 5 days or more than 3 to 5 days. Passage of big clots was also considered here. Use of more sanitary pads, okay, which was also assessed after the interrogation of various patients to assess the quantity or the amount of bleeding that was present. Pallor, how anemic she was, because that would be a parameter to test how severe the bleeding was. And obviously, lab investigations like low hemoglobin level. These all were taken into consideration when this thesis or this research work was being conducted. Okay, a little bit about the textual or classical text references about Asrigdaram or Raktapradam. The disease Asrigdaram or Raktapradam has occurred uh, under the, especially Raktapradara and Asragdaram have been mentioned by Charaka in his chapter regarding Yoni Vyapadas. Okay, these are the two terms that are used in Ayurvedic classical texts to describe the condition of abnormal uterine, excessive uterine bleeding. Okay, abnormal. Then it may be any type. It need not definitely be DUB. It can be bleeding through the vagina due to any possible reason. The references of this condition simulating excessive AUB or excessive abnormal uterine bleeding have been cited even in ancient um, classics such as Atharva Veda, Yajur Veda, and Kaushik Sutra. I've mentioned this just to emphasize how important a medical condition this was to be addressed even back in those days. So definitely there are few mentions regarding a few remedies for AUB in the ancient classics too. Okay. The classical definition of Asrikdaram. Certain sutras in Sanskrit have been mentioned by our acharyas. And I have just posted a few of them which actually describe or can be called as a definition of Asrugdaram. The first one being Ati Prasangena. Ati Prasangena again denotes the amount of bleeding. Okay, excessive bleeding. Anarutau Rutauva. This is very important. Either it is cyclical or it is acyclical also. So all types of bleeding, whether they were intermenstrual, menstrual, intermittent bleeding, or it was a superimposed cycle, all these were considered as Asrugdaram back there. Then, however, modern science has made some differentiation as based on the type of or patterns of bleeding. But under Ayurveda, all of these conditions where there was cyclical or acyclical excessive uterine bleeding were considered as Asrugdaram. Another definition is Asrugdiryate Yasmin iti Asrugdaram. Any condition in which there is excessive bleeding was considered as Asrugdaram, irrespective of the cause, whichever condition yielded to pervaginal excessive bleeding was coming under Asrugdaram. And another definition is Rajapradiryate Yasmat Pradarastena Sasprutaha. Here, specifically, they mention about menstrual bleeding. So we can very well infer that this particular shloka or this particular quotation refers to only menstrual bleeding, not the superimposed cycles or not any intermenstrual bleeding that was present. Okay, so they saw it the way they saw practically amongst the ladies back then. So these are the different definitions present in our classics, which describe Rakta Pradara or Asrugdar. Next slide, please. Yeah. So the classical definition of Asrugdaram, if we have to evaluate in terms of modern terminology, we can say that any bleeding which is excessive in terms of amount, duration, anyways. So duration, when we talk about duration, maybe the amount or the number of pads that were used were not not too many, but it was prolonged. Prolonged, it can be more than 3 days, 5 days or more. Okay, and the third criteria is irregular or erratic or intermenstrual. A cycle which occurs between two menstrual cycles. So there is bleeding apart from the cyclical monthly bleeding. Okay, all these considered as Asrugdaram. So all the conditions, whether it is excessive in terms of amount, in terms of duration, or intermenstrual bleeding, were considered under Asrugdaram. This I'm mentioning because there can be different interpretations of the same classical quotations. I have presented these particular references just to support the fact that Asrugdaram was any type of excessive bleeding, irrespective of whether it was in terms of amount, duration, or the timing of the bleeding. Now, if we go into the details of classics regarding the Samprapti or the pathogenesis of Asrugdaram, it has been inferred that various nidanas or hetus are first occurring, especially the factors vitiating Rakta and Pitta have been mentioned in the texts. As we go ahead, I will mention about a few. For example, any type of vitiation of Rakta and Pitta in terms of diet, say diet which is Katu, Amla, Lavana, basically. Okay, it leads to vitiation of Rakta and Pitta both. And these have been specifically mentioned under the hetus or the causative factors of Asrugdaram itself in the text. So all these factors, if we evaluate, they are found to be factors which vitiate Rakta and Pitta. So basically, Rakta and Pitta gets vitiated. The Pitta increases in amount, in volume, due to its Dravatva. The Dravatva or the liquidity or the fluidity of Pitta increases, and that can lead to increase in the volume of Rakta, because Rakta and Pitta have an Ashraya-Shray relation. We already know as per our concepts. Okay, so this increased volume of Rakta due to the increased Dravatva of Pitta in it is then circulated to the Garbhashaya. Okay, that is the endometrial vascular apparatus. Okay, is infested by this vitiated Rakta and Pitta. Okay, and hence, because Raja is formed in the endometrium, because Raja is formed from Rasa, according to some also from Rakta, what happens is the amount or the quantity of Raja increases in the Garbhashaya. Okay. Now, as the standard uh, text, all the standard texts of Ayurveda have mentioned one common thing regarding Yoni Vyapadas or regarding any gynecological disease in Ayurveda. The sutra says, Nahi vata atrute yoni narinam sampradushyati. So all the various 20 types of yoni vyapadas or other diseases like Asrugdara and Shvetapradara that have been mentioned in Ayurveda, they have been the individual samprapti and hetus have been explained in the classical texts. Yet one thing should never be forgotten, that none of this happens without the vitiation of vata dosha. Hence, while treating any gynecological disorder, never forget the vata. It is not up to just tackling the symptom. Like, okay, so vata has to be treated. Unless you treat the vitiated vata, you will not be curing the gynecological disease. So vata is of utmost important. No disease in Stri Roga takes place without the vitiation of vata. So this vata then stimulates the excessive flow of raja out of the garbhashaya during every menstrual cycle. Vata, by vata I mean especially the apana vayu, because the elimination of menstrual blood is the function of apana vayu. So this is the way the samprapti of Asrugdaram shortly takes place in a female body. Next slide, please. Yeah. Again, further, depending upon the dominance or predominance of the doshas, undoubtedly there is vata in every condition, but yet there is the predominance of certain doshas, and based on that predominance, different types of Asrugdara have been mentioned by our classical texts. The Asrugdara has been classified as Vataja, Pittaja, Kafaja, then the dual combinations, Vata Pittaja, which we call Dvandvaja. So Vata Pittaja, Pitta Kafaja, Kafa Vataja, and Sannipataja. All these are the different types. These are the 7 types of Asrugdaram that have been mentioned in our classical texts. Okay, we have used this classification in a particular study further, and that's why I'm mentioning the different types of Asrugdaram. Next slide, please. So, in short, the chikitsa or the treatment or the principle of treatment that needs to be followed for Asrugdaram or the classical texts clearly mention that follow the treatment that is to be done or that has been mentioned to cure Raktapitta, Raktatisara, Raktarshasa, and even Garbhasrava. So, in order to formulate a treatment for Asrugdaram, we need to go and explore the treatment modalities that have been explained under the treatment of Raktapitta, Raktatisara, Raktarsha. So all those formulations which are mentioned there, all those therapies that have been mentioned there can be used for the treatment of Asrugdaram. The primary aim and the first and foremost aim being controlling the excessive bleeding. Obviously, when a patient comes to you, the treatment has to be to control the excessive bleeding, and that can be done with the help of Stambhana treatment. Okay, so Stambhana is the main treatment that has to be followed. But is it enough to just do Stambhana? Just giving medicines just to stop the or control the bleeding, that is a temporary uh, remedy. Okay, so in order to cure the disease, you're just managing the disease. In order to cure the disease, we have to go to the core of the problem. For that, diagnosis is important. We can take help of modern diagnosis in this particular aspect. So uh, whether the problem lies in the hypothalamo-pituitary ovarian axis or the problem lies in the endometrial vascular apparatus has to be elicited or has to be explored first or diagnosed, and then only the further treatment has to proceed. Okay, so everything doesn't stop with Stambhana. Merely Stambhana is just managing the condition for the time being so that the woman does not have excessive blood loss. And then you go for the further treatments. By further treatments, I mean even Shodhana if required. Now, all the Shodhanas, especially Vamana, Virechan, and Basti, have been mentioned for the treatment of Asrugdar. Okay, I'm not going to go into the details of all these because the concerned topic in the research is that about Uttar Basti, which has been mentioned uh, as a subtitle under Basti. Okay, it is a type of Basti, and hence we will go into the details of Uttar Basti in the next slides. Next slide, please. Okay, so because the present study was to evaluate the importance of Uttar Basti. Back then, in 1999, when this study had commenced, Uttar Basti was not a very, very prevalent form of therapy in any of the places in India. Since this study was conducted at Government Ayurveda College Hospital in Pujapura, uh, a lot of women, because Kerala being the hub of Ayurveda back then, even a lot of women could be willing to take this treatment. We were able to convince many women to take Uttar Basti. It was not an easy job back then. I remember that I had, before going for my thesis work or before my research work, I had visited even institutes like Jamnagar, that is IPGTRA. I have been to the concerned experts over there. I had a word with them, and they were kind enough to allow me to explore the methods that they were following over there and the intrauterine administration of Uttar Basti. Now, Uttar Basti is a term that can be interpreted in many ways. Okay, back then only vaginal Uttar Basti was very popular or was done more frequently. Intrauterine administration of Uttar Basti was something which I learned was frequently or very commonly or on a regular basis being done at Jamnagar. So I got more and more information about them. I took advice from the experts over there, and I formulated this particular um, method of administering intrauterine Uttar Basti for my particular research work. So Kashmarya, and the one that interested me the most was Kashmarya Kutaj Grita Uttar Basti. While going through the um, explanation or classical explanation of Asrugdar, this is one Basti which caught my eye. The reason lies in its indications, which I have mentioned. Okay, Charaka mentions these three indications for this particular Kashmarya Kutaj Grita Uttar Basti. Okay, those three conditions are Rakta Yoni, which is Asrugdram or Rakta Pradar, which is our topic of research, Arajaska, in which amenorrhea. So excessive bleeding and no bleeding. Both are the conditions mentioned here. And Jatagni is repeated abortions. Okay, all these three conditions, especially if we focus on the first two potentially are very, very opposite to each other. Okay, how is it possible? The first question that arose was, how is it possible that one form of treatment is effective in two contrary conditions? Definitely, it was not for Stambhana alone. It had to be something more than Stambhana. Okay, and that is what intrigued me to go into the research for this particular Uttar Basti. Next slide, please. Okay, before going into the details, just a few words in short. In this particular study, although Asrugdaram means any form of bleeding, then it can be even due to uterine fibroids, it can be bleeding due to polyps, any underlying systemic cause also. All this comes under Asrugdaram. However, to make the study more and more research oriented, in this particular um, uh, research of mine, what we did is we dropped all the other cases and only dysfunctional uterine bleeding cases were considered here. Okay, what is DUB? Dysfunctional uterine bleeding. Abnormal uterine bleeding without any detectable organic, systemic, or iatrogenic cause. There can be an organic cause like fibroid or polyp. The bleeding because of fibroid or polyp is not considered as DUB. Okay, it has to be purely functional, dysfunctional. This is organic. So those are not considered. Systemic cause, hypertension cases were also excluded from the study. Iatrogenic, women who are using contraceptive devices, we know that copper T, which is very commonly used in India, can be one of the major causes for excessive bleeding. So that was also excluded from this particular study so that it does not affect the significance of our research work. Okay, so dysfunctional uterine bleeding cases were only considered this under this. That is the bleeding which occurs due to some abnormality either at the hormonal level, functioning of the hormonal level, or at some impairment at the level of the endometrial vascular apparatus in the uterus. Next slide, please. Okay. So DUB is the bleeding that may be abnormal in frequency. Now all the types of bleeding can come. If it is a DUB, it can be either menorrhagia or it can be an epimenorrhea. That means if it is abnormal in frequency, if there more frequent, shorter cycles, if bleeding is occurring in 21 days or even lesser than that, that is called polymenorrhea or epimenorrhea. This can be DUB also. Amount, maybe they are coming exactly after 30 days, 30 days, but the duration is more than 5 days, more than 7 days. Okay, or maybe she's requiring, even if it is just for 5 days or less than that, maybe she's requiring more than the usual amount of pads that she used. Okay, so duration, amount, frequency, or the combination of any three. Okay, was so maybe first two or the second two, all these are considered under DUB. Okay, mainly due to the local causes. As I mentioned earlier, even the pathology that occurs in DUB is mainly due to the local causes in the endometrium. As I mentioned, the endometrial apparatus, vascular apparatus. Maybe the vessels and capillaries over there are damaged. Okay, and that is the reason it leads. We know that the kinking of the endometrial vascular apparatus every month is a very major factor in controlling bleeding every month. Many other factors come into the role play. Even the presence of the particular prostaglandins over there comes into the role play for all of them work together so that the bleeding stops within 5 days. Okay, some impairment at this level, that is some impairment in the endometrial level, can lead to excessive bleeding. Okay, so the primary aim is to rectify this impaired vascular apparatus. Okay, so these are considered under DUB. And endometrial abnormalities may also occur due to primary or secondary impairment of the axis. So the cause may not be uterine, but some problem in the circuit. It's like an electrical circuit. So if the circuit, there is a problem in the main circuit in the brain at the hypothalamic level or the pituitary level or the ovarian level, even if we treat at the uterine level, it is going to transmit further. Whatever treatment you are administering into the uterus is going to transmit or a signal to the further axis. Or considering this as a hypothetical possibility, this study was conducted. Okay, and DUB cases were taken into consideration. Next slide, please. Okay, now, why this particular study? Okay, we know that modern science has these following treatments to offer for the treatment of DUB. The first and foremost and the most commonest being HRT, that is hormonal replacement therapy, which is very common, especially in the elderly age group, that is after the age of 40. This is a common treatment or trend that is followed even in India. Now, we all know that the modern treatment modalities like HRT that are given for DUB involve the risk of adverse effects, most of them being nausea, vomiting with the commonly presented, and further, even hypertension can be one of the complications. There are many more. Obesity can be a complication. So these medicines cannot be continued for a longer period. And even back then, there was awareness regarding that. Today, people are more and more aware of not being overusing these medications. Okay, so, and also going under the knife is not so easy. Even if hysterectomy is rampantly advised, especially in developing countries like India, people are becoming, it is never easy to go under the knife. Lots of do's and don'ts are there, a lot of contraindications, indications are there, a lot of potential risks after the surgery have to be taken into account. Okay, so just merely removing the uterus or hysterectomy cannot be an answer to everything, because surgical treatment like hysterectomy can pose a potential risk for future cardiac disorders also in women. Okay, more and more studies in last 20 years, even after this study has been conducted, if we see the latest research on hysterectomy, the surveys that have been conducted are definitely pointing to the fact that hysterectomy is not something that has to be done rampantly. It has to be considered many times before you go for it. So the present study is a humble effort, or a genuine attempt, you can say, to establish the relevance of Ayurveda in curing DOB. Okay, that is what was the aim of this study, why this study was taken. Firstly, because Uttar Basti was not something which was very commonly used. So there was a need to evaluate the efficacy of Uttar Basti, because it is one of the important treatments that has been mentioned in Ayurveda and had to be evaluated so that we can use it in day-to-day practice. So this study was conducted. Next slide, please. Okay. So beginning, this was a clinical study basically, and the aims and objectives for this study was very clear. Firstly, as I mentioned earlier, to evaluate the efficacy of both. KKUB is a short form I've used for Kashmarya, Kutaj, Uttar Basti. And because this was a new therapy, I had to take a control group. Okay. So Pushyanug Churna in the second group was used. Oral administration of Pushyanug Churna, which is very common, was taken into the as a control group. This is because previous studies had been conducted on the same disease, that is Asrugdar, with the help of Pushyanug Churna. Pushyanug Churna was something that was established by that time. One of my seniors also had conducted one of the studies on Pushyanug Churna. So there was a standard statistical data that was available regarding Pushyanug Churna. So it was proven to be effective, statistically significant, and hence Pushyanug Churna was chosen to be the control group. Okay. Also, interesting part was to explore the efficacy of a therapy that is intrauterine as against something which was orally administered. Okay, so we had to also see the difference between what is the difference between both the treatments, both the line of treatments. Then compare their results. Pushyanug Churna has also been, as I mentioned, clinically evaluated in the previous studies. Second, to analyze the effect in the study group. Okay, because sample size definitely are never, no one single study is ever enough to prove something. But yet this was a small effort to analyze the effect of the study group. What exactly the Kashmarya, Kutaj, Uttar Basti could do in such cases of Asrugdar. That was an attempt was made to evaluate. Try to evaluate the possible mode of action of Uttar Basti. Why do all this if there are just churnas and pills to be given? If Granthakaras, if you go to the text, a long list of medications, herbs, diet items have been mentioned for the treatment of various forms of Asrugdaram. Then what was the need to mention Kashmiri Kutaja Uttar Basti for Rakti? There has to be a purpose. Okay, when the conservative line of treatment doesn't help, you need to go for specialized treatment modalities. And hence, we needed to evaluate the possible mode of action of Uttar Basti. One of the aim was to evaluate this mode of action in this particular study. Then, to find the most effective treatment for Asrugdar, whether oral administration helps more or administration of Uttar Basti would be helping more. Now, even if we always have to select a disease or a disease condition for a research therapy, but the main aim was whichever disease it, because one of my colleagues with me who was also conducting a research in the same field in our gynec department, she conducted simultaneously a study on intrauterine administration of Uttar Basti, but not in Asrugdar, in Udavarta Yonipath, that is dysmenorrhea cases, with the help of Bala Taila. So she was doing the same Basti with Taila intrauterine for dysmenorrhea. At the same time, I was doing this intrauterine Uttar Basti study for Asrugdar cases. So two studies regarding intrauterine Uttar Basti have been conducted at the same time in those 3 years back then. Okay, so the data is available on the internet. Next slide, please. Okay, the study groups. Obviously, group A was the study group, that was Kashmarya, Kutaj, Uttar Basti, intrauterine administration. Okay, I'm mentioning this because intrauterine administration was done. This is a procedure which needs a lot of preparation, as in terms of having a small unit wherein it needs to be disinfected at a very high level. All the instruments needed to be sterilized. So with the help of autoclave machine, each time we administered to every patient that we did. And we needed to evaluate this, and we needed all the equipments and care that needed to be done, okay, with the help of intrauterine Uttar Basti. And group B was the control group, obviously, because previous studies had been conducted on the effect of Pushyanuga oral administration, on which have been proved earlier. So this study was to study the effect of group A as against group B. Next slide, please. Okay. Next, we come to the materials and methods that were used. First thing is selection of cases. How did we select? Now, select the certain number of patients coming visiting the OP department of Government Ayurveda College Hospital. Now, Government Ayurveda College in Trivandrum in Kerala has 3 hospitals attached to it. Okay, the major one being in the prime city of Trivandrum. Okay, it is a major hospital for Kachikitsa and Shalakya and Shalya. Whereas there is a second hospital in Pujapura. It is a distance of about 20-25 minutes from the main college. This is a second government Ayurveda college hospital that has this functions exclusively for women and children. Okay, and there's a third one for Swasthavrutta also. So all the 3 hospitals are attached to the government Ayurveda College Institute, and all the patients who visit over there are treated free of cost, with a meager amount of 2 rupees back then for a case paper. Medications also were given free of cost. All the treatment modalities, right from Basti, Panchakarma, everything was done in free of cost, because of course, because of the Rajamanyata that they have over there. Okay, so recognition of the government is an important part. So selection was done of all the cases in which the women who were having excessive menstrual bleeding, and those who visited the OP department of Government Ayurveda College Hospital for Women and Children, Pujapura, Tiruvananthapuram. Then history taking. Now, although we had a larger sample size in mind, okay, we did take history. We did select a lot of women for this study, but the continuation of the study, taking 3 cycles of Kashmarya done. I forgot to mention earlier, when we administered Kashmarya Kutaj Uttar Basti, Ghrita Uttar Basti, it was done for 3 consecutive cycles for every patient for 3 days. So 3 days after the first menstrual cycle, 3 days after the next menstrual cycle, and 3 days after the third menstrual cycle. So 3 consecutive months it was conducted. Intrauterine Uttar Basti was administered 3 times every cycle. Okay, on the 5th day of menstruation. Okay, 5th or 6th, when it was reduced, the flow was reduced. Each of these cycles was preceded by Niruha Basti, Niruha and Anvasan Yoga Basti, which was also done in every case before her menses, every cycle. Okay, so Niruhat Uttar Muttar Basti. So that was strictly followed over here. Okay, and hence you can understand the number of patients that discontinued also. There is no consistency many times, and because this being a rural, um, majorly a rural population area, it is even more difficult to maintain patients into continuity. But we managed to maintain a minimum sample size that is required for a research study, that is 10 in each. So 10 women, we were able to give Uttar Bastis for many more, but those who reported for the statistical analysis were 10. Okay, so in each group. Sample size was enough for any statistical evaluation, and all these 10 women were evaluated for 3 months and were continuously given 3 months Uttar Basti. Okay, and the other group, of course, 3 months continuous administration of Pushyanuga Churna orally. 3 grams of Pushyanuga Churna before meals was given for every patient. Okay, a detailed history taking was done for every patient based on the basis of a pre-designed proforma. We had designed a proforma which, according to which we took a detailed history of the duration, symptoms, chief complaints, past history, family history of the patient, menstrual history, obstetric history, contraceptive history, the food, diet and dietary habits, the bowel movements, urinary habits, every and the sleep pattern, and on the mental status, okay, the psychological status. All of these were evaluated for every patient who visited. Physical examination was done for every patient, a thorough general examination, that is the height, weight, pulse, BP, respiratory rate, everything was taken into consideration, along with a thorough pelvic examination of every female patient who visited. That is per vaginum examination and per speculum examination, just to rule out any possibility of fibroid, polyps, or any other growth which may be a cause of bleeding. So, in whichever ladies were presented with these conditions were excluded from this study. Obviously, because we had to be more scientific in our approach. And lab investigations were done for all these women, commonly being hemogram was assessed for every case. Urine routine was done for every case. Urine routine, especially not only to rule out any form of infection that the woman had, because we had to give intrauterine Uttar Basti, we had to be very particular that the woman did not have any pre-existing infection, which we might possibly aggravate. Okay, so this had to be done. And second important thing is urine routine also consists of urine pregnancy test, which was done, so that we rule out any woman who might be pregnant at that time, lest we end up into any complications. Okay, another fact is also only married women were taken into consideration for this study, because intrauterine Basti, Uttar Basti, was not something that we could administer for virgins. Okay, so just to put that into perspective, what we did is we considered only married women. So married women, even if they were nulliparous, even if they were infertility patients, they were taken into consideration if they had Asrugdar. Okay, because consummation of marriage was what was the major criteria that was taken into account over here, so that we could administer Uttar Basti for those patients. Okay, and endometrial biopsy for every patient, all the patients in this group, we took a endometrial sample and we got the histopathological um, study done, just to be sure that there is no cancerous growth or there is no other underlying organic cause. Okay, so this was a very essential thing, not very easy to do, to convince the patient for an endometrial biopsy. Take the sample, we had to carry the sample all the way ourselves. We had to collect the samples, we had to carry them in those bulbs, and the study was not done at our college because the facilities or the required equipment was not available. I had to take it to the government medical college, that is the MBBS college of Tiruvananthapuram. I used to carry those samples there, give it for histopathology, go and collect. We did not have WhatsApp and we did not have social media back then. So collect the reports physically, because you cannot send a patient to do that. You have to do that. So we got those reports done for every patient. Okay. Just to be sure that we were not including somebody that who had an underlying condition that would create a bias in the study. Okay. Or may also diagnose a deadly disease like endometrial cancer in time. Okay. Both the objectives were taken into consideration. Next slide, please. Exclusion and inclusion criteria. As I mentioned, I have covered a lot before, but just to be more specific, which cases were excluded from this study? Okay. Obviously, systemic diseases like the cases, the women who had Asrugdar but also were hypertensive were excluded. Because many a times, just controlling the hypertension or giving antihypertensives also helps in many cases. So we did not want that. We needed to illustrate cases which were exclusively DUB cases. Okay. Either due to some problem or impairment at the level of the endometrial apparatus or due to some HPOU axis malfunctioning. Okay. So we did not want these other things to bias, because otherwise, in either ways, just giving an antihypertensive could have helped. Okay. So that affects the efficacy of your treatment or the importance of your treatment. So hypertension was excluded, diabetes was excluded, tuberculosis cases were excluded, nephritis cases were excluded. Of course, from safety point of view, bleeding disorders. Now, many times, many women have bleeding from any channel of their body, okay, most commonly being the menstrual channel, just because of some bleeding disorders, okay, a bleeding and clotting disorders. So bleeding and clotting time was also done under the hemogram, okay. So all those women who were found to be having bleeding disorders and even cardiac disorders were excluded from this study, okay. Then patients with structural abnormalities such as uterine fibroids, PID, okay, PID is pelvic inflammation disease, polyps, and ovarian tumors or carcinoma were also excluded from this studies. Whenever we had a doubt, we advise the patient ultrasonography, and if they were found to be having any of these conditions, they were excluded. Patients using IUCD, okay, that is intrauterine contraceptive device, commonly copper T, these were also excluded because we know that just stopping the use of these contraceptives could have helped. And steroidal contraceptives as well, those who were take on OC pills were also excluded from this study. Okay. Then inclusion criteria was all those women who did not have these conditions which are mentioned under exclusion criteria, and those who were having at least 3 months history of menorrhagia, that is excessive bleeding in terms of both amount as well as duration, or both. Polymenorrhea, okay, that means frequent menstruation, even if the amount or the duration was not more, but they were having cycles more frequently, say 21 days, 20 days, or 15-day cycles also in some cases. Okay. And the third criteria was metrorrhagia, which is clearly intermenstrual cycles, intermenstrual bleeding. So bleeding in between two menstrual cycles. Okay. These all were considered under the study or included in the study. Next, please. So before going into the details, because this Kashmarya, Kutaj, Uttar Basti, and one thing to note is this is not an Uttar Basti or this is not a Ghruta which had n number of ingredients. It had only 2 ingredients, that is Kashmarya and Kutaj. Very specific. Why Kashmarya and why Kutaj was something that intrigued me. Okay, so if you go and study Kashmarya, okay, what we did back then was what I did was I selected Kashmir that was available in the market at that time. Because if you go in 10 different states, you will find 10 different Kashmiryas. We know that is the case. Okay, just because of the subspecies and other of every drug, that are available everywhere. So the Latin name of Kashmir is Melena arborea, and that which was sold in the market under this name is what I considered for the study. I took 2-3 samples from the various other places. Okay, I purchased them. I visited the Dravaguna department of Government Ayurveda College and respected Dr. Pillai sir, who was the head of the department of Dravaguna. I took his advice for the same, and he helped me identify the Kashmarya that needed to be used. Okay, so with the help of our of the experts, the particular Kashmiri was selected. Okay, Jmelina arborea. It is commonly known in English as kumtik or Kashmiri plant or trees. The family Verbenaceae. Properties as per Ayurveda of Kashmir. Kashmir. It is one of it is one of the Dashamulas also. Okay, Kashmir. That is the Brihat Panchamula. Okay. So property is rasa, majorly tikta kasha and madhur in rasa. Virya is ushna according to some texts and shita according to some. Some say the fruit is shita, but the plant in itself is ushna. So there is a little bit of difference of opinion over here. Vipaka, again different opinions are there, Katu and Madhura. Okay. Some say it is Katu, some say it is Madhura. Guna, Guru, majorly. I have written only the major properties. Okay, there are n number of properties that have been enlisted here. Root bark, the parts that was used. Now, although, if you say interestingly, fruit is something which is more useful as far as Asrugdar is concerned. But because we had to prepare a gruta, the part that we used was root bark. Okay, so root bark, okay, not bark of the tree, root bark was used for this. Okay, it is said to be useful in raktarshas and raktadosha. Okay. So in the present study, root bark was used. Second drug is Kutaj, Latin name being Holerina antidysenterica. English name Kurchi, Apocynaceae family. Again, rasa, tikta and kashaya. Okay, understandable because kashaya is a stamban rasa. Virya shita. Vipak is katu. Guna, laghu and ruksha. Okay, now that was guru and this is laghu and ruksha. Bark is again useful. Now here the bark of the tree or the stem or the trunk is used. It is useful in raktarshas, raktapitta and raktadosha, any raktapradosha. In the present study, the bark was used. Okay, next slide please. And grita. So basically grita was processed with the help of Kutaja and Kashmarya. Okay, now if we grita is important. Why grita was selected? So if we go into the properties of grita, grita is nothing but cow ghee or clarified butter. According to Ayurveda, it is everybody knows that it pacifies vata and pitta, enhances the quality of rasa and shukra, dhatus, and even oja. Okay, it is shita or cooling in property. It is mrudakara, softens the tissues. It enhances voice and skin complexion, and it is sanskaranuvarti, that is, accepts the attributes of the drugs that are mixed with it. Okay, which it is treated with without leaving its own original properties, and that is what makes Grita very special. We all know that. Next slide, please. I also went into a little bit of modern science evaluation of Grita. What is the effect of Grita in the body? Okay, so it was proved that Grita is, we know it is yellow, white in color, and the yellowishness, some are white, some are yellow. Yellowishness depends on the carotene content of the Grita. Okay, the more the carotene, the more yellowish it is. Okay, ghee also contains vitamins A, D, K, E. Understandably, because these are all fat soluble vitamins. Vitamin A helps. Now, one specialty of vitamin A is that it helps to keep the epithelial tissue of body intact. This is what interested me. Okay, I needed to work on the endometrial tissue, epithelial tissue of the endometrial, and probably more and more absorption of vitamin A because of Gruta might help into it. Then ghee resists the spoilage by microorganisms or chemical reaction. Again, if there has been some impairment, if there has been some damage at the level of the endometrial vascular apparatus, if there is some damage due to chemical, we know that hormonal reactions are nothing but chemical reactions over there. So maybe because of that, or any other external cause. If this has occurred, possibly Grita can help. Okay, this is just a hypothetical consideration at that time. Highest absorption rate, Grita has an highest absorption rate of 96% as compared to the other oils and fats. Okay. Ghee also has a very effective delivery to the target organ and makes it crucial for maximum benefits. When that is the reason we use. Why so many medicated ghees have been mentioned in Ayurveda? Okay, the reason, and especially for procedures like Basti or procedures like Uttar Basti, especially, is because it is a superb way of targeting an organ. So if you have to carry your medicine to a particular targeted organ, the best way to administer is Grita. It will take it faster. Reason being, in the next point I've given, the active ingredients of a herb used to medicate the medicated ghee are mixed with ghee, right? Lipophilic action of ghee facilitates the transportation to the target organ and delivery inside the cell membrane. So basically what Grita does, it takes all the active ingredient from that herb and it goes and delivers it at the target organ inside the cell membrane with the process of lipophilic action. Okay, and that is what makes the efficacy of all these medicated Gritas so important. Next slide, please. Okay. This is obviously because group B was our control group and already study had been conducted. I have just given in one chart that shows what are the contents of Pushyanuga, which is our group B. Okay, it was administered in a daily dose of 3 grams for 3 consecutive menstrual cycles before food, of course, because it was apanakala, with honey or tandulodak, either of the two. Okay, so these are the contents, the names of all of the herbs that are come under are in the mixture of Pushyanuga. If you see, most of them are, there's a combination of Ushna Shita. Okay, there are, most of them are Kashaya, Madhura also, and Tikta also in Rasa. Okay, so evaluation of Pushyanuk had been already done by Dr. Ashok, who was my colleague, and also many other studies had been conducted on Pushyanuk Charana. Hence, this was taken into consideration. So you just know, see the number of, there are almost 26 dravyas that are present in Pushyanuk Charana, which is popular, which we very popularly use in day-to-day practice even today. Okay, it is very effective for Asrugdar. Next. Okay. Now, so I'll just go through the observations. Now, as far as the incidence of the age, now see, we did not just evaluate the statistics of after result, even the incidence, okay, occurrence of the disease was taken into consideration. As far as the age is concerned, if you see group A and group B, in both the groups, the orange color represents the women with age of 40 and above. Okay, so 40% cases in group A were in age more than 40 years, and more than that, that is around 60%, or say around 50, no, sorry, yeah, 60, 40, yes, 60% around were above 40. So if you see, the orange color is what is striking. Okay, major number of women in the study, either in both the groups, were belonging to a post-menopausal age. Age is a very important factor as far as Asrugdaram is concerned. We said it is more, even DUB cases are more prevalent in both reproductive age as well as premenopausal age also. But maximum study, the maximum women in the particular study were aging 40 and above. And we know that this is mostly a premenopausal phase where many women can encounter this excessive bleeding problem commonly. Okay, so majority of the total patients were in premenopausal age in both the groups. Others that used IUCD long in the past were also taken, even if there was a contraceptive history, because they were 40 plus, and if they had used in some time in the past, these were considered, as long as they were not using the contraceptives presently. So we ensured whether even the PV examination was done for that, whether there is a leftover IUCD that is in the uterus. Okay, because see, the patients coming were from a rural background, language problem barriers were there, so it is very difficult to understand from them, and they did not even, many of them, they were not aware of IUCDs and all these things also. Okay, so next slide please. Now we also elicit, because being a rural area, all most of the patients came from a lower class group. Okay, you can see that, and some of them from the middle class group. We had hardly any patients from the upper class, obviously, because all those coming for um, free treatment were definitely from this. And the importance of the reason I put this slide is, if you see, most of the patients were from the lower and the middle class, this being the specialty of Ayurveda in Kerala. Our hospital was a hospital which had maximum number of cases from the rural areas of Kerala, in and around Tiruvananthapuram, and even cases who could not afford high level treatment. Okay, from the lower and middle class, the hustling class, we can say. Okay, and this is very important, because when we have to see the efficacy of Ayurveda, the mass is important. Okay, and treatment should be made available easily at a lower cost for all these patients, and only then the true essence of Ayurveda will be achieved. Okay. Next slide, please. Okay, as far as the body build is concerned, in group A, you will see that almost the green color represents the lean patients. So in both the groups, in group A, 50% cases were lean, and in the group B, 20%. 30%, which is a considerable amount, were of moderate build, and 80% cases in the second group were moderate. Very few patients were overweight. Okay. Now the criteria used for this: lean were the patients weighing less than 45 kgs in weight. Moderate were those who weighed 45 to 55 kgs. And overweight were those who weighed above 55 kgs weight. So this was how the categorization was done. Now, since this data is very small, no definite correlation can be actually established. Okay, we need a bigger survey study to actually say that, okay, lean built patients are more prone to having Asrugdaram, or obese patients are more prone. Okay, so because the data is small, we did not derive to any conclusion over here. Next slide, please. Parity, which is very important. Okay, as I told you earlier, we had considered only married patients in the study. Okay, none of the unmarried patients in both the groups, none of them were considered for both the groups. So as long as the parity goes, there were a few patients, considerable amount of patients who were nulliparous. The orange color actually represents group B. Just a minute. Yeah, and it's just reversed, okay, here in this case, because I think the data was fed in that manner. And group A is green in color. The most important thing is women having, in both the groups, either of the groups, women having 2 children, okay, were the maximum. Now this can also be because earlier, you know, that the parity 3 or more, even in 99 and 2000, okay, we had because the crowd was coming from a rural area, we had women who were having 3 or more children, but most of them having 2 children, also because post independence, the drive for birth control was there. A maximum number of patients were, at least at our hospital, most patients who delivered at our government Ayurveda College Women's Hospital were uh, were convinced to undergo tibectomy. Okay, so 2 children obviously was most commonly found. So again, although, you know, if you see logic wise, the more the number of parity, the more the possibility of Asrugdar. Okay, although nulliparous women can also be prone to Asrugdaram. So again, parity, to prove the parity, a correlation between parity and the occurrence of Asrugdaram, we need a larger study. Okay, a larger survey. I'm sure many studies must have been conducted in this particular field after that. Next slide, please. Prakriti. Now this is our Ayurveda. Okay, Prakriti, in short, was elicited for every patient. Okay, we know that commonly the Samadoshaja Prakriti and Ekadoshaja Prakriti is something which is not so common. Okay, those which are commonly found are dual prakrutis. Okay, dvandvaja prakrutis. Either they may be vata pitta, pitta kapha, or vata kapha. Now, in group A and or group B, the yellow orange color represents vata kapha prakruti. Okay, so in both the groups, almost 40% patients were having vata kapha prakruti. The green is vata pitta prakruti. Okay, so in group A, 50% were vata pitta, and in group B, 30% were vata pitta. And kapha pitta in group A was just 10%, and kapha pitta in group B was 30%. Now, if you see in both the group, vata kapha and vata pitta are more commonly. So, in the entire study, the number of patients who are having either vata pitta or vata kapha prakriti were more. Okay, the common factor here being vata. Okay, we know that the dominance or the prakriti of a particular person is important from the prognosis point of view, right? When we analyze the prakriti of a patient, it also helps us to analyze the prognosis of that patient. All women who had dual prakriti in this particular study, obviously, because most of the patients have dual prakriti, their prakriti has a very vital role to play in prognosis, and overall maximum incidence was found in vata kapha and vata pitta. Okay, as against pitta kaphaja prakriti. Now here the dominance of the vata dosha is what needs to be paid attention to. Okay, next slide. Could this be one of the reasons why Asrugdaram may be occurring in this group more? Pattern of bleeding. Okay, now pattern was divided into these four categories majorly. Okay, excessive bleeding, women who had excessive bleeding. Now the one on the this side is on the left side of the screen is group A, and the data for the group B. Sorry, it has been misprinted. It should be group B. Okay, on the right side. So now in group, the categories were excessive bleeding, prolonged bleeding, intermenstrual bleeding, or frequent bleeding. Okay, excessive was the criteria that was taken into consideration was all those women who required an average of more than 4 to 6 pads per day. Now you know that pads is, although I understand that is a very not a very proper way of analyzing the amount of bleeding, because the use of pad can be individual depending on the individual hygiene preferences. Some women prefer to change pads frequently, and some women prefer to change them less frequently. So, but even then, hence the number was considered bigger. If women required more than 6 pads per day, then only those were considered as. Now, most of the women, those who were visiting this particular center or this very particular hospital, did not use pads also. They were using home clothes. Considering, especially those coming from the lower socioeconomic class, were using those. So the number of cloths that were used were also taken into consideration. Obviously, a woman knows when she is bleeding more. So excessive was those cases. Prolonged were cases where the bleeding exceeded more than 7 days. Okay, only those were considered as prolonged cases. Okay, intermenstrual was menstrual women in whom the menstrual bleeding was occurring at 15 to 16 days interval. Okay, so there was say 2 cycles, and in between on the 15th day, say around 15 day cycle, after the 15-day cycle, again there was bleeding. Okay, these cases in between 2 normal cycles, there was some bleeding episode in between 2 normal cycles. Okay, so it felt as if the woman was bleeding every 15 days. Okay, this is what we call a superimposed cycle. Okay, it can come superimposed on a normal menstrual cycle. And frequent, okay, the bleeding that was occurring at 21 days. We know that after a particular age, the cycle shortens, especially if there is some ovarian malfunction, then the cycle shortens to 21 days. Okay, so because of the hormonal imbalance, periods can occur every 21 days. Okay, so this is called polymenorrhea or epimenorrhea. So these cases were also considered. So if you see in both group A and group B, now you'll see that this is 170 because there could be two conditions existing. Although in both the groups, all the patients, that is 100% patients, were having excessive bleeding. Means they were using either more number of pads, or they were having, the number of pads that was used was more. Okay. But 70% in both the cases also had prolonged bleeding, which means out of the 100, 70 of them had both excessive bleeding as well as frequent prolonged bleeding also. Okay. And 30 were having only excessive bleeding. In group A, none of the patients had intermenstrual bleeding. In group B, 10% patients had intermenstrual bleeding. And in group A, again, frequent bleeding was present in 20% cases, and none of them had frequent bleeding in group B. So if we see the green and the orange, again, excessive and prolonged seem to be more dominant in both the groups. Okay, that is in terms of duration and in terms of quantity. Next slide, please. Okay. Along with the bleeding pattern, some associated symptoms were also analyzed. Although, it is difficult to see evaluate the efficacy on every symptom that is present over here. Okay, so what I have done is tried to put it in one chart. Okay, what was the incidence of, now those which are mentioned down on the horizontal axis are the different associated symptoms that women in both the groups overall in the whole study were considered. Okay, so if you see the symptoms such as towards the right side of the screen, that is from insomnia onwards, insomnia, breast tenderness, GI disturbances are not very frequent ones. So very few women presented with these symptoms. Okay, few were having excessive sweating, say around 40% cases, but others were less than that. See the taller bars, the taller columns. Pain during menstruation was maximum in more than 80% cases. Palpitation, lethargy was in almost 70% cases. Pain in calf muscles was also seen. Fatigue was seen. Dizziness was seen. Okay. And very few had again recent weight changes. So just, this was illustrated just to see the incidence of associated symptoms, because when Asrugdaram or DUB have been explained, some associated symptoms are also occurring. However, we have in our study, we have emphasized more on the excessiveness, prolongedness, or the frequency of bleeding pattern itself. We have emphasized more on the pattern of bleeding because we had to see the effect on Asrugdaram. Okay, and not on the associated symptoms. Next slide, please. Okay, as far as the characteristics, again, duration of bleeding and duration of bleeding days in both group A and group B. 3 to 5 days cycle was seen in 10% cases of group A, 5 to 10 days in 40%, and 10 to 15 days. Here also 5 to 10 days and 10 to 15 days was most commonly in group B also. So most patients had a cycle or bleeding pattern for 5 to 10 days. Okay, very few had more than 15 days of bleeding in both the groups. Okay, so most of the patients presented with a bleeding pattern of 5 to 10 days. Next slide, please. Interval, after how many days they were getting periods. Okay, this I have put in this pie diagram. In group A, if you see the yellow color, 50% of the cases had 20 to 30 days cycle. Okay, so that means they menstruated every 20 to 30 days. And in group B, the blue color, that is 57% cases were such in which the cycle was more than 40 days. Okay, so prolonged, so delayed cycles. Although a considerable amount in group B, that is 33%, also had 20 to 30 days cycle. So we can say that most of the patients presented with 20 to 30 days of cycle altogether in totality. Okay. Next slide, please. Now, incidence of clots. Clots were also taken into consideration because we know that the presence of big clots in menstrual bleeding is an indication of excessive uterine bleeding. Okay. In both the group, pay attention to the orange color in group A and group B as well. In group A, 50% cases, there were at least 1 to 3 clots, and in 60% cases, 1 to 3 clots. Not more than that. Okay. Severity was seen only in group B, that is only in about 20% cases, the blue color. Okay, sorry, the green color, 20% cases in group A, sorry, the dark green color. So maximum patients presented with 1 to 3 big clots. Now I am talking only about big clots, okay, not the small ones, because small ones can occur normally also. Next slide, please. Color of menstrual blood. This was taken into consideration because in Ayurveda, this has a lot of importance. Okay. And we need to ask this question in our OPD also to the women. Okay. So if you see in group A, the darker shade, that is the bright, 40% cases had bright red color menstruation. Okay. Then 40% cases also had dark red color menstruation, and only 20% had pale red. Same, almost same in group B also. Most of the patients had bright and dark red color and only 20% pale red color. You know that the color can represent the predominance of doshas over here. So Vata and Pitta seem to be more predominant in group A and group B incidence also. So this again proves that, because the dominance of dosha is also considered according to the color of the menstrual blood. So that is the reason I put this. Okay. Next slide, please. Incidence according to the amount of bleeding. Okay, in group A, again, those who were having moderate bleeding, that those who had to use less than 5 pads a day, were only 30% in the group A and only 20% in group B, whereas maximum number of patients in both the groups, 70% in group A and 80% in group B, had excessive bleeding, that means had to use more than 6 pads per day. Okay. So most of patients actually, as I said, that can differ from person to person, but because more than 6 pads was our criteria, that was found in maximum cases. So this study does hold valid for everything. Next slide, please. And as far as the type of Asrugdram, we saw the different types of Asrugdram. Okay, the different colors in both the diagrams represent Vataja. The green represents Vataja type of Asrugdram, the yellow Pittaja, the orange represents Kafaja, Vata Pittaja, Pitta Kafaja, and Vata Kafaja. So if you see the greens in both the groups, the solely Ekadoshaja, that is Vataja type of Asrugdaram, was considerably seen in both the groups, that is 40% here and 30% here. Again goes to show the importance of Vata dosha in this particular disease. Okay. Then below that, say the 20% cases in the one in blue, sky blue color. Okay, the 20% cases in group A were of Vata Pittaja category, and even in group B, 40% cases were of Vata Pittaja type of Asrugdram. So Vata is there, Vata Pittaja is there. Maximum cases were Vataja or Vata Pittaja, and very few of them belong to the other categories. So most cases were either Vataja or Vata Pittaja type of Asrugdram. Next slide, please. Now, incidents according to dietary habits. As I told you, a total detailed history was taken into consideration. Now, I have taken into consideration only on the vertical axis. You can see some food patterns. Whether the patients were vegetarian, mixed. Obviously, solely non-vegetarian does not occur because it is a combination of veg, non-veg in India. So, vegetarian, mixed category. Patients who are continuously using consuming excessive amount of kattu, amla, and lavana rasa. Okay, curds, because curds is some which is commonly used in Kerala. Okay, pickles is very highly consumed in Kerala. Chilies, okay, and fish. Now, the orange color represents group A and green color represents group B. So again, it has got changed. Sorry. So group B is orange color and green color is group A. Okay. So if you see in both the groups, now what the group doesn't matter here, because what we have seen is in both the groups, the maximum number of 90% cases were having a high consumption of fish, obviously because fish is one of the staple foods of Kerala, and high consumption of mixed diet as well, obviously, and kattu amla lavana rasa, which is very high, up to 80 to 90% in both the groups. Okay, kattu amla lavan because they will be eating a lot of sambar, which has a lot of tamarind in it, a lot of tomatoes, It has a lot of spices in it. So, and which is drava also. So anything that is katu, amla, lavan, and drava will be a cause for Asrugdar. So even if the women are not in Kerala and back here in any other state or any part of the world, you need to analyze them for this particular pattern of food. Curds, Dadi is Abhishandi again, and maximum patients, a considerable amount of patients, 30% patients consumed curds. Pickles, very famous. Women love pickles, so most of them consumed a lot of pickle. And fish. Matsya is something, actually it is indicated for amenorrhea cases. So if you're not having bleeding, Matsya comes as a treatment. And excessive Matsya consumption or fish consumption can be a cause of Asrugdara or excessive bleeding. So understandable over here. Next slide, please. Now, very short, in short, results of the study. Now, both the studies after the clinical trial was conducted, the statistical data was collected for both the groups, and the efficacy of both the drugs was assessed on the basis of improvement in the presenting complaints. By presenting complaints, I mean the duration, amount of bleeding. Okay, that was there. Disappearance of associated complaints were also taken into account. I mean, they had fatigue earlier and then it was reduced. Okay, but however, we couldn't emphasize more, otherwise it would have completely changed the track of the study. So only it was noted down, no correlation or no inference was illustrated out of it. Improvement of general health. Okay, the blood pressure and all the parameters were also assessed after every follow-up. 3 follow-ups were taken after every month, okay, for 3 consecutive months. And regularization of menstrual cycle. All these following parameters were used to assess the patients. Next slide, please. Okay, now this is a little bit of statistical. Okay, back then we had, as I said, we had very few resources. So from whatever was available, the data that was available, with the help of our statistician, we managed to find the paired t value and p value for, because since it was a small sample study, the t value, paired t value was what we, was a test that was applied over here. Okay, now the change in menstruation was statistically analyzed on the basis of various menstrual variables. So in the first column, you can see menstrual variables that were used were the flow in terms of pads per day. Okay, that was taken. So how many pads were required per day? Okay, and their mean was found out. Mean is the average. Okay, so in the second column, you see before treatment, what was the average of pads required? Because this particular table is for group A exclusively. There is no group B here. Then second is after first follow. Okay, the mean number of pads, the average number of pads that were used after the first follow. And based on that, the tests were applied and the pad T value and P value were found out. Similarly, for duration of flow also, the same thing was applied, and for number of clots also. So if we see in group A, the mean mean number of pads that was used was 6.7 pads per day in the first, before treatment. 5 pads, it reduced drastically to 5 pads per day after the first follow itself. That is after 1 month of treatment. And the paired t value and the p value was still less than 0.001. Okay, now we know, you just need to know one thing, that p value less than 0.05 is always statistically significant. Okay, so our p value came into the range for the number of clots later, and the lesser the p value, the more effective your or statistically significant your study is. So this is just a statistical variables, what I have concluded in the end for you. Okay, so this is how the statistics was conducted after the first follow-up. Next slide, please. Now, same variables, that is the flow in terms of pads, duration, and number of clots was used, assessed for group B also. Okay, so all the charts in the orange color are for group A and green color are for group B. Okay, P value and T value were also assessed here. Now, instead of going into the T and P values, we'll just see the variables. 6.8 pads were required on an average mean before treatment for group B. That was Pushyanuga, okay, which reduced to 5.7. Duration of flow was 9 days on an average, which reduced to 8.35 days after the first follow-up. And number of clots was 2.4 earlier, which reduced to 1.7. Okay, and that was statistically analyzed. Next slide, please. Same thing, flow, duration, clots in group A after second follow-up, that is after 2 months. So the second column, just pay attention, because the first column is the second column is going to be the same before treatment. Okay, 6.7, 10.05, and 2.75. Just the second follow-up, sorry, this should be second because in the table it is not mentioned. Above in the title, it is given follow-up 2. So this is after the second follow-up. Again, a considerable reduction, even more, 6.7 to 4.25 in terms of flow, 5.65 in terms of duration, and 1.20 in terms of clots was observed. Okay, and p-value was assessed for the same, T and p-value. Next slide, please. Same way for group B also. Again, in this group also, we found a considerable amount of reduction in terms of flow, in terms of pads per day, from 6.85, although it was 4 in the group A. Here it came out to be 5.45. Okay. Duration of flows came down to 7.8 days, and number of clots came down to 1.6 after the second follow. Next slide, please. And after the third follow-up, again, further improvement was seen in terms of flow in group A. That is, pads were reduced to 3.65 per day. Flow was reduced to 5.25 days. So from 10 days average to 5.25 days, and number of clots from 2.75 to 0.60. Okay. Next slide, please. And for group B, again the flow was reduced to 4.6 from 9 to from 6.8 to 4.6. Flow was reduced from 9 to 8. Flow, that is in terms of duration, was reduced from 9 to 6.8, and clots from 2.4 to 1.3. Now see, these numbers are nothing but how much improvement was seen. Okay, and paired t-value and p-value are always to show whether the difference between the two groups was actually very significant, or if we increase the data or if we elongate the data, whether it will hold any significance for this. So that is what was evaluated from these values. Okay. Next slide, please. Just to show you in the form of a line diagram here, for group A, it is green color, and group B, it is orange color. Okay. You can see a steep or a better reduction in terms of amount of menstrual flow in group A, that is the green color, okay, as compared to the group B. Okay, there is a minor difference, but there is a difference. Okay, almost starting from the same point, but the green has reduced further to 3.65, whereas the orange has reduced only to 4.6. So there is a little minor difference in the reading. Group A proving to be slightly better than group B in terms of amount of menstrual flow. Next slide, please. In terms of duration of menstrual flow, again, the orange is group A and the blue is group B. Okay, the group B is almost horizontal, flat, whereas the group A has come down considerably. That is, the duration of menstrual flow also was seen, showed better results in group A. Again, not much, but yes, there is a considerable amount of difference in the result both. And I'm saying less because the sample size is very small. Okay. Now, if you take a bigger sample size, probably this difference will be more. Okay. Next slide, please. And in number of clots again. Okay. Group A is the green one and group B is the blue one. A steep reduction in number of clots was seen in group A, and a considerable amount was seen in group B as well. Okay. Next slide, please. Hemoglobin levels were also assessed before and after treatment. The green line and the orange line. Okay. Now this I'm not really considering because the level of starting of hemoglobin in both the groups was different. So if you see the rise in hemoglobin, it does not become very significant over here. Okay, because the starting point should have been almost same for both the cases, say either from 10 HB to 12 or whichever group. Now this has begun from 9 and that has begun from 10.5. So we can't really come to a definitive conclusion. Next slide, please. Now, analysis of the result. Okay. After all the statistical analysis, the cases were categorized as cured, improved, and no relief. Okay. Cured were those who having regularization of menstrual cycle, including reduction in bleeding in terms of bleeding duration and number of clots. Okay. Either of the two were reduced or any two categories. Okay. Either bleeding and duration or duration and clots or bleeding and clots. Okay. So if these reduced, these were considered as cured. Improved were normalization. Sorry, if all the three reduced were considered cured. If improved were those in which two characteristics were improved. So any of the two, amount duration or duration clots or amount and clots were improved cases, and no relief cases were no response to the treatment. Okay, all the symptoms also persisted. Next slide, please. So if you have to elicit in the terms of cured, improved, and no relief, in group A, 60% cases were cured, and in group B, 50% cases were cured. So almost same number of cases. Slightly, group had an edge over group B. Okay, that is group A is our study group, KKUB. Okay, then improved. 20% cases were improved in group A and 40% cases were improved in group B. No relief was seen in 20% cases and in 10% cases of 20% cases of group A and 10% cases of group B. So we definitely had patients who also showed no relief at the end of 3 months of treatment in either cases. Next slide, please. So result of treatment in both, again the same thing I have presented in a form of pie diagram. Okay, no relief cases. So the yellow color represents cured cases in both the cases. Okay, again sample size being small, a further study definitely needs to be done at a bigger scale. I'm sure many more must have been conducted after that. So we need to go and explore them also. Next slide, please. Okay, again, terms of parity, we saw better improvement. Now just pay attention to the few, just see the parity of one child cases in both the groups. Almost the same number of cases were seen to be cured in both. So all the women who had a lesser parity had a better cure rate. And two children cases had a moderate amount. 3 in group B, obviously more because there were very few patients. So that will not take into consideration. One child parity had better results as compared to 2 children parity. Okay, obviously because we also relate parity can affect the endometrial apparatus. Okay, can increase the surface area of endometrium, and that can be the reason that the more the number of children, the more the possibility of excessive bleeding. Okay, or the higher the severity of excessive bleeding, that can be illustrated. Next slide, please. Okay, as long as the body built, again, as I mentioned earlier, this is not actually a very good criteria according to me, but still, nevertheless, we had the data available for that. So in both the group A and group B, if you see the yellow color, that is the cured cases, were seen more in the lean and moderate categories. Obviously, because there were no patients in group B in obese category, it is difficult to elicit. So as I said, sample size should have been bigger. Probably would have got more obese patients. So this would hold any significance. Next slide, please. As against the Deha Prakriti. Now, if you see in both group A and group B, if you see the Vata Pittaja type of Prakriti, okay, the green color, okay, that those are the improved cases, and the orange color are uh, no relief. Sorry, green is the cured cases and yellow are the improvement. In both the groups, if you see the green bars, okay, they are more predominant in Vata Pittaja almost. Okay. And in group B, more predominantly, the cure rate was higher in Pitta Kaphaja. Okay, cases. So probably Pushanuk Churna works better on Pitta Kaphaja cases, Prakriti cases, and Kashmiri Kutaj showed better results in Kapha Vata and Vata Pittaja type of cases. Again, Deha Prakriti short duration of treatment, 3 months is not really enough to elicit that. But the data was found. Next slide. Okay. Correlation of result with type of Asrugdar. Now all the 6 types are mentioned on the horizontal axis. Okay. The green are cured cases, the orange are improved cases, and the blue are the no relief cases. Maximum cured cases in group A can be seen of Vataja Pittaja and Vata Kafaja type of Asrugdaram. Type, okay, this is not Prakriti, this is type of Asrugdaram. Okay, so bit dominance of doshas. And in group B, again, Vata Kafaja are more and Vata, comparatively as compared to improved cases in group B, that is the orange in the second category, can be seen considerably in Vata Pittaja and in Vataja cases. And cured cases again, Vata Kafaja. Nevertheless, in all the types, in both the groups, Vataja cases, especially in KKUB, that is group A, all the Vataja, Vata Pittaja, and Vata Kafaja cases showed better improvement. Okay, as against Pushyanuk Churna. Next slide, please. Now, A versus B, we know that when we find the T value and the P value, they are against assessed. Both the groups are whether the difference that you found, we showed that there was minor difference between the treatment efficacy, whether it is statistically significant or no. These are the charts. The inference is what I need you to focus on. Next slide, please. I've just presented the charts for all the three and have the inference has been done. Yeah, the inference. So after the statistical, because statistics, you have to have sessions with your statistician back then, and he or she guides you into whether your study that was conducted, whatever study was sample size was used, which test has to be applied for this, and whether your study that has been done, if there is any difference between both the groups, whether it was statistically significant or no. Okay. Now, KKUB, that is the Kashmiri Kutaj Uttar Basti, is as effective as, now pay attention to the words, is as effective as Pushanuk Churna in the management of Asrugdaram, although their routes of administration in the body were entirely different. Okay, almost the same efficacy in both. Now, Uttar Basti is a procedure that is targeted to the exact site of manifestation of the disease. And Ghritam pacifies both Vata and Pitta. Probably that is the reason in all the cases in which Vata was predominant, were showing better result in group A. Okay. So while properties of Kashmarya and Kutaja are Rakta Stambhan by nature, those Snigdhata of Ghrita, okay, pacifying nature of Ghrita on Vata and Pitta, effect of Ghrita on Vata and Pitta, and Rakta Stambhan properties of Kashmarya and Kutaja. Okay, these all probably combinedly help to cure Asrugdaram. Okay, Uttar Basti can be used to regularize the HPO use access. So definitely one thing I understood from this study is it did show improvement at the level of the vascular apparatus in the endometrium, better than Pushanuk Churna. Okay, and to carry forward, since I said this is just a small sample study which was done in those 3 years, I did practice in my day-to-day practice since last 20 years. I've been using intrauterine Uttar Basti for various treatments, not only Asrugdaram, but most commonly for other conditions as well. I can say for sure that Uttar Basti, intrauterine Uttar Basti specifically, definitely intermediates or mediates with the endometrial vascular apparatus stature. Okay, it helps to repair that if it is damaged. It helps better receptor activity. You know that the hormones also act on that particular organ only if the receptors of that particular hormone are also functioning well. So the at the receptor level in the endometrium also, Uttar Basti definitely has a good result. Okay, it gives us better, improves the receptivity of the uterus to the hormones, and because it improves the receptivity as a feedback, you know, the hormonal cycle all depends on the feedback also. Negative or positive feedback improves, and hence the entire functioning of the hypothalamo pituitary ovarian axis comes into play over there, and it helps to improve. So it is just not a local effect. It's not only Stambhan, or it is not just pacifying the vata at that level. Okay, it can also trigger a hormonal reaction. Okay, so this is what my experience after this study in 20 years says. Okay, so the efficacy can be uh, elevated to that extent. So Uttar can be used to regularize the HPOU axis by improving the receptor functioning of the endometrium and the ovaries too. Remember, when you give the Uttar you administer it inside the uterus. The whatever grita or medicine you are giving, it is going through the fallopian tubes into towards the ovaries also. It gets absorbed there also. So definitely, even at the ovarian levels, you can expect the efficacy of Uttar Basti, and even at the autonomous nervous system. We all know that how important the autonomous nervous system is in terms of even all the functioning of these organs. Next slide, please. So, conclusion. Finally, we drew the conclusion for the study. It was concluded that Kashmarya Kutaj Uttar Basti and Pushyanuga Churna both are effective in controlling excessive bleeding in the terms of amounts, clots, as well as duration of the flow. But KKUB, that is Kashmiri Kutaj Uttar Basti, that is a study group, showed better results in terms of duration of flow. Okay. Both the treatments are more effective in Vata predominant and Vata Pitta predominant types of Asrugdar, and showed slightly lesser results or not much effect or efficacy when Kapha was involved. And Uttar Basti is a specialized treatment that can be given to patients of DUB not responding to any type of oral medicine treatments. Obviously, Uttar Basti requires a lot of preparation, mental preparation on the part of the psychological preparation on the part of the patient. It is a doctor's job also to make the patient. So I have seen in practice after this study, because this was a study that was had a stipulated amount of time, so we could not take obviously infertility cases, because in our 3 years of study, it was impossible. 2 years actually, 2 years of study, it was impossible to follow up patients for infertility for 1 year, 2 years. Okay, so we had to select both my colleague and myself as well had to select diseases which could be easily uh, assessed. Okay, the effects could be easily assessed. Also, the statistical analysis could be done. Okay, hence we did not take complicated cases like infertility at that time, although many studies after that on infertility have been conducted as regards Uttar Basti. We can go and see the data. So this was selected. But after that, when I practiced this study also gave me the confidence of using Uttar Basti, intrauterine Uttar Basti, more commonly and more effectively in my practice. So definitely that has helped a lot, and Uttar Basti does prove to be a very, very important line of treatment when it comes to gynecological treatment. Not always, or oral medicines do not help in all conditions always. Okay, specified treatment, targeted treatment has to be done in many cases, especially of Stri Roga. Okay. I hope, uh, I think this is the last slide, right? Next slide, please. Yeah. So I hope this humble effort of mine, I've tried to put it as humbly as possible in front of you. I know there are many flaws in the statistical analysis of it every way, because research has advanced so much in these 20 years. Okay, but back then, in whatever resources were available, this was the study conducted at a place like women's hospital in Pujapura. Okay, so this is what. Thank you for giving me this opportunity, Dr. Asawari, present my work in front of all of you. Thank you. Thank you so much.
Thank you so much, Dr. Deepali. It was wonderful. It is
Thank you.
such a thorough study you have done back then, when intrauterine Uttar Basti was not popular.
Yeah.
You did a wonderful job. And thank you so much for taking time to explain every single step of all your work. This is absolutely amazing. It is very, very useful actually for everybody who is going to listen to this webinar.
Yes.
Thank you. I
Thank
just
you.
have one quick question. It's regarding the Pushyanuga Churna. So it was given 3 grams apano for 3 consecutive months. Was it given throughout the month or was it given only during the menstrual period?
We had to give it throughout the month, because keeping a follow-up of every case, because each woman had different dates, to follow. So, and whether she was bleeding or not, again, was very difficult to illustrate. And I believe personally, even now, that Pushanuk children sometimes needs to be given all throughout the cycle to have that effective treatment. Again, as I said, if it had to be only Stambhana, then it would have been specifically mentioned for that. And we have many single drugs which are having very nice Stambhana property. Why the combination of all these 25 drugs, 26 odd helps together, definitely has to be a more extensive purpose for it. Okay, so that is the reason we gave 3 grams of Pushyanuga. And another reason is Pushyanuga churna, even in the amount of 3 grams, if it was given in some jungle area, desha wise, because Kerala is mostly an Anupa desha. My personal experience has told me that the prakriti of people, the abhishandi guna of the food, and the humidity that is present in the atmosphere generally leads to more of kapha vitiation, or snigdhata is more. So you can very safely give Pushyanuga. Same goes with Basti also. I had many experiences with, I can see a drastic change in the response of people to specific medicines like Pushyanuga. Here in Maharashtra, it might cause a lot of dryness and constipation in most cases. Whereas in Kerala, I did not really find that, because of the predominance of this maybe snigdhatva in everything. Pushyanuga did not really cause much. And the reason we used that 3 grams was because that was our control group. So I had to match up with the previous studies that were done. I had to give that in that dose in whatever study was already done before that. And I had to compare my study with that. And hence this dose was selected throughout.
Okay. Absolutely. Makes sense. Yeah. And it was given with honey, right?
Honey or tandulodak.
Okay.
Either. Although my personal experiences, if it is a kaphaja predominance, honey will help better. And in Vataja and Pittaja type, Tandulodak will help better.
Okay. Sounds good. Yeah. Thank you so much. This was absolutely amazing webinar. Thank you so much for all your time, and you have done wonderful, very exceptional work.
Thank you. Thank you for giving me this opportunity. Thank you. Thank you so much.
So thank you for all the everybody who has attended the webinar. This webinar will be uploaded to the CAR YouTube channel. So please watch and subscribe to our CAR YouTube channel so that you can also watch some earlier webinars and other presentations. Please like, comment, and share all the videos. Once again, I invite you all to become a member and also fill out the volunteer form if you are interested into becoming a volunteer for Council for Ayurveda Research. You can now also subscribe to our Ayu Update newsletter to stay tuned with our projects and different events that we do at the CAR. And if you have any questions, please feel free. You can always contact us at Ayurveda Research USA at gmail.com, or you can always also email me at at asavari at mnayurveda.com. I work as a chair for this global CAR webinar research series since few years, and I would love to talk to you and get back to you about anything that you are interested in. Thank you so much, Dr. Deepali.
Thank you. Thank you. Thanks so much.
Bye-bye.